Chair. House Bill 1045 is an act concerning criminal victim notification, concerning the release of a person who committed a criminal act and was adjudicated to have a mental disease or defect. When I ran this bill on the House side, I had a witness with me. She approached me with her story up in Jonesboro, Arkansas, letting me know that as a healthcare worker, a mental health care worker, a therapist, a social worker up there at Mid-South Health, one afternoon following a therapy session with her client, one of her clients remained behind and approached her. He had concealed a butcher knife in a plastic bag and pulled it out and began to stab her repeatedly, lacerating her leg, her arm. I think she's had numerous surgeries to repair the nerve damage, but she almost bled to death that day in that facility simply because one of her clients that she was trying to help stabbed her. The thing is, I couldn't get her back down here. She was 37 and a half weeks along in her pregnancy and has since delivered and is at home with her newborn baby. But I can tell you that when she brought this story to me, one of the concerns she had is she wants to remain in the mental health care industry and continue to serve her clients. But she said, Brant, we don't have any notification system right now that lets us know as healthcare workers that our clients who may commit a crime like this and go in for maybe observation or to the state hospital, once they're released, there's no victim notification. And she said, my concern and several others that work in the same field as I are going to walk around the corner, say at Walmart or Kroger's or maybe the mall, and there our attacker will be out back in public. The thing about her attacker was he had done this 2 previous times. Shot a police officer and stabbed another healthcare worker repeatedly. And each time he went into long-term observation and care and treatment and then released back into population, but there was never any notification. And so what I did was I sat down with the BLR and then later with the ACIC and began to talk to them about the criminal notification system. And the thing is, I was really taken aback when Brad Kazart came to me, and I think he's here today, somewhere back in the back. But he presented me about 2 minutes before the initial committee hearing, and he said, Brant, do you know what the fiscal impact will be on the state if they enact a notification system like Vine? And it caught me off guard because I was told it probably wouldn't be that much, but the annual maintenance, well, the initial cost to place the booking system in each facility was going to be $486,000 with an annual maintenance fee of $648,000. So after some work with Mr. Kazart and others, we were able to reduce that basically down to zero, or a simple one phone call, in-state phone call from a mental health facility to the state hospital, and because they're already on the Vine system, they can push out a notification to victims that work in our healthcare system for just their awareness and to be alert that their attacker will be back out in the population. And so this bill passed, I believe, unanimously out of the House Judiciary. It passed off the House floor with a wide majority vote, and you have it in front of you today. I don't know if you have it in front of you, but one of the things that we also had to work through was showing great care and discernment when it comes to HIPAA laws. This bill does not violate any medical records of an alleged perpetrator of a crime. We're protecting their HIPAA rights, so there's no controversy there. It simply says when a person with mental illness is released back into population, if they committed a crime, their victim will be notified by the state through the bind system. And with that, I'll take questions.
Members, do we have any questions? Seeing none, is there anyone in the audience? We have no one signed up to speak for or against the bill. Seeing none,